So my name is Dr. Tower. I have been with the practice for quite a few years now, and a big component of our practice is mommy makeovers. As a mommy myself, I do have 3 kids. I have a really good understanding of what the woman's body goes through and all the changes and all the disappointments that come after after you've had your child, and you just notice that your body is very different and a lot of things have changed. Some people bounce back so well and really don't have a lot of issues, and some really don't ever really, regain the bodies that they once had before and really end up with a lot of loose skin. They may have their breast a little bit deflated, and there's ways we can, there's things we can do to help rejuvenate the body and get you back to where you were before children. So when we talk about mommy makeovers, it's really a combination of a breast and tummy procedure that's going to get you back to your body before children. So this could be all sorts of different combinations of procedures. So when we say mommy makeover, it's not one procedure fits every patient. It's very individualized. So each patient that comes in, we come up with a plan for them specifically, and everyone can be, just slightly different. So one of the I'll give you an example. A combination would be you feel like your breasts are deflated after surgery, but they're not very saggy, so maybe you just need some breast implants. So we could do breast implants, but you notice on your tummy you've been left with a lot of extra skin, which would require, skin removal, which would either be a mini tuck or a full tummy tuck. So let's go back and talk a little bit about breast. So if we just require a breast augmentation, there's different ways we can do this, and there's different implants we can use. So a breast augmentation is either done with a saline or silicone implant, and there's several incisions that we can use. Either around the areola, we can make an incision under the fold, or even one in the axillary. And if you really don't want an incision on the breast, you can have it even done through the belly button. If you do require a lift, there's going to be more incisions that are made. How do we decide if you need a lift or not? Usually it's by the position of the nipple. So if you notice that when you look at your breast and the nipple is pointing down, or there's a lot of extra skin and the nipple is now hanging below your natural fold, you're going to need a procedure to remove skin in order to lift that nipple back up to its normal position. It may take a little bit more than just an implant. You may need to do both. So you may need volume and lift to kind of regain the youthfulness of the breast. Other things that some people experience after children is that their breasts have gotten very large. So you may also want to get a breast reduction. And so when you do a breast reduction, you get a breast reduction and a lift. And some patients just really want to reduce the size of their breast, and that would also be considered, part of a mommy makeover if that's what you desired. When we talk about the tummy, again, there's different things that people experience after children. Some people just have extra weight that they just can't get off. And extra weight usually is seen around the flanks or the waist or their lower abdomen. A lot of women call it their little pooch, and they just can't get rid of it, but their skin is actually in really good condition. And these women may just need some liposuction to kind of trim their waist back to what it was. And they may not need any skin removal at all. So we could just trim you up with liposuction. Another new advancement that we have is something called Renuvion. And the nice thing about Renuvion is we can use it in conjunction with liposuction to help tighten skin that may be just a little bit loose, doesn't need a tummy tuck, but just doing liposuction may leave you a little bit loose. We can add that Renuvion to it, and it helps tighten the skin. So that may be an option for someone as well. If you do need skin removal, there's 2 different procedures that we like to do. One's called a mini tuck or a dermal lipectomy, and one's a full tummy tuck. So let me tell you a little bit about a dermal lipectomy, because some women come in thinking that they're good candidates for dermal lipectomies, and they really aren't. But if you just have skin in that lower portion of your abdomen and your muscles are in fairly good condition and you don't have separated muscles, then a dermal lipectomy is probably a good option for you. You can do some liposuction along with it and then just remove some skin in the lower portion of the abdomen. The thing you have to remember is if you have loose skin in the upper abdomen, it's not going to do anything for that skin. So that's how you know if a mini tuck is right for you. You look at that upper abdomen, you see if it looks pretty flat. If it's pretty flat on top but hanging at the bottom, then a mini tuck is a good option. When we do a full tummy tuck, and that's probably our most common procedure for mommies, we do several different things. We do a little liposuction of the waist. We're able to access all of the muscles in the midline, so it gives us the opportunity to correct for diastasis recti, which is that separation of the muscles that pregnant women get a majority of the time. So we correct for the muscles, we'll replace the belly button, and then we'll remove all the skin that's below the belly button. So you get the most of the skin removed with the tummy tuck. It's the most skin removal. The separation of the muscles gets repaired, and you also get liposuction of the waist. So that really corrects for most of the issues that women have after having several pregnancies. I think that pretty much covers most of the procedures that we do. So if you're thinking you want to do a mommy makeover, just come in. That's the best way to kind of know exactly what's going to be best for you. You may not require what your friend required or what another mommy down the street required. So just let us come up with a plan for you, and I know you'll be really happy. So I'm Dr. Tower, and I hope to see you soon.